Welcome to this COVID-19 awareness program brought to you by OHSS Savvy Consulting. Now that you have completed Module 1, what is COVID-19 and how does it spread? Let us take a look at Module 2, how can COVID-19 be prevented? COVID-19 is a deadly virus that is rapidly spreading. However, it can be stopped. You need to do your part. COVID-19 can be prevented by us when we wash our hands, wear a mask, practice coughing etiquette, social distancing, and when we clean and disinfect. Let us take a look at each of these in more detail. Washing your hands is important. You should wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. But make sure that you clean your thumbs, your wrist, fingernails, palms, and the back of your hand. Rinse properly with clean water and dry your hands thoroughly. Wearing a mask is vital to prevent the spread and contamination of COVID-19. Wearing a mask helps to protect us from breathing in the virus from infected persons, and if we potentially are infected, it prevents us from infecting others. But ensure that you only use a mask that has been washed and ironed. Wash your hands before putting the mask on. Ensure the mask covers both your nose and mouth properly. Then make sure it fits well and is tight. Once you have put the mask on, do not touch your face again until you take it off. Wash all cloth masks with warm soapy water and iron when dry. Wash your hands thoroughly afterward. You must have at least 2 cloth masks per person, so you will be able to wash one and have a clean one ready for use. Practicing coughing etiquette is important in the prevention of the COVID-19 virus. Ensure you cover your cough or sneeze with a tissue. Use a bent elbow if you do not have a tissue. Always ensure you throw the tissue into the bin. Wash your hands for 20 seconds after coughing, sneezing, or using a tissue. If soap and water are not available, use an alcohol-based hand sanitizer. In order to ensure we protect ourselves and those around us, we are encouraged to practice social distancing. This includes things like avoiding handshakes, keeping 2 meters apart, limiting social groups, not touching any unsanitized surfaces, putting up physical barriers between yourselves, customers, or visitors of the public. Do not share items such as pens, papers, cutlery, or even personal protective equipment. Ventilate your office and home well, and ensure that you wear a mask when commuting to and from work. Ensuring a clean and disinfected workplace and home are vital to preventing the spread of COVID-19. Ensure you do the following: deep clean offices and workplaces. Wash your hands regularly with soap and water. Clean and disinfect your vehicle to prevent cross-contamination. Clean your clothes and PPE regularly. Clean and disinfect toilets and toilet facilities. Sanitize and clean frequently touched surfaces often, and always ensure a regular supply of hand sanitizer is available. If you are feeling sick or have any of the following symptoms, you must follow the COVID-19 protocols. If you have a cough, fever or chills, sore throat, nausea, body aches, loss of smell, or loss of taste, you might wonder, what do I do? Should I self-isolate, or quarantine? What is the difference? Let's take a look. Self-isolation refers to any voluntary act of home-based quarantine by any person who might or might not have been exposed to COVID-19 to contain the possible spread of COVID-19. Self-isolation can be applied to and by any person to curb the spread of COVID-19. Quarantine is the separation and restriction of movement or activities of persons who are not ill but are believed to have been exposed to infection for the purpose of preventing the transmission of diseases. Persons are usually quarantined in their home, but they may also be quarantined in community-based facilities. Let's recap. COVID-19 can be prevented in many ways. We must ensure that we regularly clean and disinfect our homes, offices, and workplaces, as well as our vehicles. Keep in mind to ensure good hygiene wherever you go. Ensure you promote regular and thorough hand washing by always having water and soap available. If water and soap are not available, use a 70% alcohol hand sanitizer. When washing your hands, make sure you wash your hands for 20 seconds. Always ensure you wear and require anyone entering your home or workplace to wear a full face mask that covers both nose and mouth. Keep the environment well ventilated and clean. If you have any symptoms, you must self-isolate and ensure screening takes place every day. Should you need to be tested, ensure you stay quarantined or self-isolated until your test results return. If you are tested positive, adhere to your healthcare provider's guidelines. Don't forget to watch Module 3 and 4 to know what employers and employees should do. Thank you for watching Module 2. Please answer the questions below before moving over to Module 3.